Now, as the Ghana Health Service readies itself to take stock of the first batch of COVID-19 vaccines, several questions are being asked about the jabs even before they arrive, from safety to efficiency and scope of vaccination. Here is a wrap of some of the major concerns that have been raised so far and answers provided by health authorities.
It's a vaccine.
It's a simple and a safe and an effective tool to protect people against harmful diseases before they come into contact with them. So it is not a treatment. A vaccine does not treat you after you get the disease. A vaccine is a preventative tool that has to be administered before you get into contact.
Which vaccines is Ghana getting?
The AstraZeneca Oxford vaccine manufactured by Serum Institute of India, and what you call the Sputnik V, which is manufactured by a company in Russia.
How safe are these vaccines?
So a vaccine is simple. It is not a very complicated mixture. It is very, very safe. And the single most effective immune booster you can take is a vaccine. All these drinks you take, whether it's orange juice or Percocet or whatever it might be, a vaccine historically and today is the best immune booster. So if you want an immune booster, when the COVID-19 vaccine arrives in Ghana and you are one of the people who is able to get it, please go and get it. That is the ultimate immune.
Are the vaccines able to deal with the new strain we have in Ghana?
Our dominant strain in Ghana is the UK strain, for which the AstraZeneca works well. Even for where in countries, in places where the South African one, the issue is that it still prevents severe disease. And so it's not that it's not useful at all. The WHO has come out that it's still good enough even for that strain. But luckily for us, our dominant strain is the UK strain, for which the AstraZeneca and the other vaccines we believe will be working. And as we say, we will continue doing surveillance as we go on. When we find anything, we'll change course.
Does this mean? At what cost and what is the population target?
The initial target, based on the safety profile of the vaccines, we are targeting approximately 20 million persons. And these persons are health workers as based on, this is based on the segmentation, persons with underlying health conditions, security personnel, other essential service providers, persons above 60 years, students of second and tertiary institutions, teachers at all levels, specialized groups called the executive, legislature, judiciary, the MDAs, the media, and of course the rest of the population will receive the COVID-19 vaccines.
Why is it important for me to be vaccinated?
Vaccination is safe, effective, and to prevent a lot. Currently, vaccination protects us from about 20 diseases, and WHO records show that it saves 3 million lives every year. We need a vaccine because it's effective and it has been used in various cases in the country. Now that our borders are closed, etc., this gives us the best opportunity to vaccinate the people of Ghana. We have also, there's less and optimal use of the protocols. People are not using the protocols, so it cannot be the panacea. It's a good panacea, but it also goes to add that because of the low face mask use, vaccination coming at this time will be very, very helpful. We have continual community transmissions, and so we cannot take those things for granted. And
which categories of individuals do not qualify?
And of course, we use a combination of these depending on the situation. So the vaccines or vaccination will be expanded to include children and pregnant women as time goes on and as more safety data become available.
What are the possible effects I may get from the vaccines?
And we've been monitoring the international scene. So for anybody who's used Sputnik, any country that has used it, we know the adverse events that have currently been experienced. And so far, it is the normal slight temperature, chills, some injection site reactions. We have not got any adverse events of special interest that causes us concern. If anything like that comes up, because we are also working with all the other countries within the WHO drug safety monitoring system, we will hear about it. And
what are the common myths about vaccines?
The data would bear me out to say that it has been extensively studied and there is no support for the fact that vaccination in any way can lead to autism.
How much must I pay to be vaccinated?
vaccines in Ghana are wholly free, whether it's COVID, whether it's measles, they are not paid for. They are paid for by the government. So the average Ghanaian does not pay for it. It's free.
Great.
Well, hopefully some ideas and some answers for your questions. Let's get on the website of the Ghana Health Service, take a look at what the figures, what the numbers are saying. So far, we have 506 new cases, which seems pretty low from the initial 600 we were doing in a day. 506 new cases so far. Our active cases, by the way, stands at 6,812. So far, 582 people have died. Well, over the weekend was about 577. Well, here we are, 582. 582 people have died. Let's keep taking care of ourselves.